Do you know that you can actually reverse type 2 diabetes? You've probably heard that type 2 diabetes is a chronic progressive disease. You will have it for life. It will just get worse. You will be on maybe diet control, then maybe on medication, then maybe insulin, or maybe the insulin will be introduced earlier. But ultimately, it's a chronic progressive disease. You will have it for life. It will get worse. You will suffer the complications, some of them or all of them. It could be your eyes could be affected, you could have hypertension, you could have heart disease, you could have kidney failure, neuropathy, and a number of other problems. Diabetes affects your complete well-being. Your complete body is affected. On top of that, patients with type 2 diabetes live on average 10 years less than the general population. So when we say that diabetes is a chronic progressive disease, it's not entirely true. You can actually reverse type 2 diabetes. You need to use medical science in your favor. Now, the American Diabetes Association recommends that you take around 200 grams of carbs per day. Many guidelines would say 40, 50, 60% of your energy should come from carbs. Now, what is this with carbs? Carbs are actually turned into glucose in your body. So they are more or less synonymous. If you take carbs, it will increase your blood glucose level. If it increases your blood sugars, of course, you would need more medication. If you still keep on taking 200 grams of carbs per day, according to the guidelines by the American Diabetes Association, and a lot of national guidelines all over the world. If you keep on taking around 200 grams of carbs, you will still be adding a huge amount of glucose to the system. The body is already having a tough time managing your diabetes, managing your high blood glucose levels. Of course, what happens, you'll have some oral medication trying to control your blood sugars. If it still doesn't work, you will be put on insulin, or sometimes insulin is started earlier. But ultimately, we are trying to bring your blood sugars down after raising them through our diet. This sounds quite paradoxical. Why not just reduce carbohydrates in the diet in the first place? If you take 20 grams of carbs a day, if you take more proteins and even more fats, you are not going to spike your blood glucose level to the same extent. If your blood sugars are already controlled before they even get high. Of course, the pancreas will then need to secrete or produce far less insulin. Maybe the pancreas in type 2 diabetes in many patients will be able to manage just that load of carbohydrates and keep the blood sugars at an appropriate level without insulin externally or oral medication. If your pancreas is not completely burned out, the lower intake of carbs would actually put far less strain on it. It will, in many cases, be able to handle the glucose load itself and maintain a proper blood glucose levels without the help of oral medication and insulin. Of course, if you are taking oral medication, if you're taking insulin and you move directly into low carb, you have to be very careful. You don't want to go into hypoglycemia. Going into hypoglycemia can be disastrous. It can lead to a number of serious complications. You need to do this under medical supervision. We are here. If you want to reverse your type 2 diabetes, chances are we will be able to help you. Chances are we will be able to put together a diet and, more importantly, to give you the information you need to understand your diabetes much better than you have been able to through the past 5, 10, 15 years of having diabetes. My mother was under treatment through a very renowned center in Denmark for her diabetes, type 2 diabetes. For the past 15 years, she has been using insulin. She was among my first patients where we changed her diet. We put away all the official guidelines and I put her on my own diet with low carbs. It's not something I've invented. There were other giants before me. The traditional way of treating type 2 diabetes and type 1 diabetes before insulin was discovered was actually low carb. Anyway, I put my mother on low carb. Within a month, we could do away with her insulin. In 2 months, we could do away with her paracetamol and ibuprofen. She was taking that for pains, aches in the body, shoulder pain, back pain. And she had been using that for a long time. It bothered her a lot with the pain. At 4 months, we took her off one of her medications for hypertension, another medication for her cholesterol level. Now, we are working with her to reduce her medication even further. This can be done. We can reduce your insulin users. We can reduce your oral medication for diabetes. We can reverse your type 2 diabetes in many, many cases. Not of all, of course, especially if your pancreas is completely burned out and if it's not producing enough insulin at all. If it's not producing insulin at all, we cannot revive it as yet. So, if you have type 2 diabetes, you're on oral medication. It means your pancreas is producing insulin. If you're on insulin, chances are it is still able to manage a certain load of carbohydrates in your food. And if you keep your load below that level where the pancreas can manage it, well, you can reverse your type 2 diabetes, do away with your insulin, do away with your medication. It is a process. It can be done. We have done it. Patients have been very happy. They've been losing weight and the complications of diabetes have gone down. So I strongly suggest you do speak to us and we'll guide you through the process. Thank you.